This is Metabolic Mastery, a KORR Medical Technologies podcast dedicated to advancing knowledge and practice in metabolic testing. Welcome to Metabolic Mastery, brought to you by KORR Medical Technologies. I'm Dr. Marc Humbert, and this is my co-host, Dr. Cameron Garber. Today, we're going to be talking about fats and carbs and why measuring CO2 is important. And so to start off, let's dive a little bit into the science of metabolism. So how are fats and carbs being used? Why is oxygen important?
Yeah. So oxygen is definitely important that we measure oxygen with cardiopulmonary exercise testing. Super vital to be able to get some of those, insights and clues into where somebody's at with their fitness and their training or their health. And so looking at their exercise capacity, oxygen is a great value to measure, obviously. But often we leave out carbon dioxide. There are several other products and things that don't measure carbon dioxide. And even KORR sells some devices that we don't have carbon dioxide in. So they're great at giving us a snapshot of where we're at in terms of our fitness. It's kind of like a bod pod or a DEXA scan or bioelectrical impedance. It gives you a snapshot of where they're at right now, but it doesn't give insight into where they have been, where they need to go next, and where the problems are coming from. And that's what CO2 gives us. CO2 provides those essential clues into what may be going wrong with the system. It tells us exactly how we have been training, and then lets us know what we need to do in terms of training moving forward to get the adaptations that we want. And so CO2 is a vital thing to measure with cardiopulmonary exercise testing so that we can really dive into that person's body and what it's doing and how it's doing it so that we can make better decisions about how to help them exercise and moving forward, as well as weed out, is this a cardiac problem? Is this a pulmonary problem? Is this a metabolic problem? Those things we can weed out if we have CO2 data. Without CO2 data, we have no idea where their limitations are coming from. We can measure whether or not they're limited, but we can't measure why they're limited or where those limitations are coming from.
Yeah.
So that's why CO2 is so critical when we're testing kind of at that higher level.
Yeah. Well, and it's the other side of the equation, right? Like O2 goes in, CO2 is the output.
Right.
And so it links both sides of that equation of metabolism. And so one of the things that we talk about often with carbohydrate or with carbon dioxide is the respiratory exchange ratio, right?
Mm-hmm.
And so what's the ratio between oxygen in and carbon dioxide out?
Yeah.
When we are burning substrate being fat or carbs, is going to tell us that this respiratory exchange ratio is going to tell us a lot about that. So when we take a molecule of glucose, it's going to take 6 oxygens and then 6 carbon dioxides are going to be the output. So that respiratory exchange ratio is going to be 1, right? 6 oxygens, 6 carbon dioxides, 1. The kind of standard fat that we use for fat metabolism, when we're kind of talking theoretically, conceptually, is palmitic acid. And so you have 23 O2s go in and then 16 CO2. So we're having to onboard more O2 to metabolize a molecule of fat. And so that puts that respiratory exchange ratio closer to that 0.7. So 0.7 to 1 is kind of the standard range of that respiratory exchange ratio. And that gives us an idea if we're burning more fat at that 0.7 end or more carbohydrate at that 1.0 end. And so knowing those, like you said, can give us a range of insight into what's happening with the heart, the lungs, kind of our metabolic flexibility, if you will, how easily we switch between fuel sources. And so it gives us some insight in what's going on at a cellular level. And because we're always using fat or carbohydrate for energy, right? Usually a mix of them.
Mm-hmm.
But having that insight really, like you said, gives us an idea into training, into areas that we want to take a closer look at, right? Where do I want to zoom in, and what other questions do I want to ask? What other tests might I want to perform given the data that this has given me?
Yeah, it just really gives us so much more insight. Again, like I said, KORR sells A couple of versions of our cardio coach only have oxygen, and they're great if your goal is to just get that RMR value and VO2 max. Like if that's all you're trying to do is get that VO2 max value and give that to your patients, because we see that a lot with firehouses or police stations or um, gyms and health clubs where their only goal is, I just want to give you your VO2 max number and that's it. Great, that's a perfect use. If you want to give anybody additional insights into their health, fitness, how they should train, heart rate zones, more accurate values of their anaerobic and aerobic thresholds, all of those things, we can dive much more accurately into all of those when we have carbon dioxide values.
Yeah, absolutely. So let's dive into some of those things one by one, those extra things that we can look
We're
at.
diving in today.
We're diving in. So first, let's talk substrate utilization, right?
Yeah.
That mix of fats and carbs. How is the data that we're getting from a test with CO2 giving us insight into those, into how we're using substrate?
So again, when we go back to that RER value, we can see is this mix, and like Marc said, we're almost always burning a mix of fuels. It's rarely are we burning 100% fat or 100% carbon dioxide or carbohydrate until we get up into those higher exercise ranges, obviously, when delivery of fat to the muscles just is not keeping pace with how hard we're working. But so we're almost always burning a mix of fuels. And so looking at that RER can help us to understand how we're burning that mix of fuels. And one thing that's been shown is that the correlation between heart rate and RER levels, or fat and carbohydrate burn levels, is actually fairly predictable for the same activity. And so we can use those fat and carbohydrate burn levels to help us set exercise zones. And we've talked about that in the past on this podcast, but we can more accurately set where those zones are happening based on specific physiological events where those burn rates change up, so that we're training the right metabolic systems in our training, so that we're building endurance or we're building the ability to shuttle lactate and improve those top end systems and delivery of fuel and oxygen and everything to the muscle at that high end. And so it's vitally important to be able to see exactly where those zones are supposed to be and where those metabolic inflection points are. And so when we talk about metabolic testing, we really can't test someone's metabolism if we're not looking at the carbon dioxide as well.
Yeah, both sides of the equation.
Right. And so there's some will criticize that, oh, we see fluctuations though in those values, that we'll see a fluctuation sometimes in VO2 or VCO2 values at different times of the day or with different meals or things like that, which is partially true. But it actually, the correspondence between heart rate and RER is actually very high, especially once you get into an activity. So if you go and eat like a goo or a gel or something like that, and so your blood sugar spikes initially, that will throw off those RER values for a little bit in relation to heart rate. But if you sustain that activity, it actually drops back to normal after a second. And so that's one of the things, if you're just doing a 12-minute VO2 max test and you do one fasted and then you go eat something or you do it the next day or whatever, and you eat something and you go and do it again, and you're going to find that there's very different values. The reason why is because that VO2 max test isn't long enough to burn off the excess blood sugar from having taken that hit of glucose, whatever form that comes in. And so really, glucose or fructose or whatever, if you do an adequate warm-up prior to your test, usually that neutralizes the increase in blood sugar from whatever you've eaten to some degree, depending on a lot of factors there. But usually that neutralizes it. And once we get into the test, especially if you do the longer form tests where you're looking at substrate utilization, once we've kind of burned off that excess blood sugar, things look the same from test to test.
Yeah. Well, and so I'm gonna go a bit into the weeds here. So like you said, as we start an effort, if we've onboarded something more carb heavy, we're going to see that rise in RER, and then that comes back down as we get into the exercise. But what's important is when we're doing the test, right? We've standardized these variables, we've gotten them in a fasted uh, place, and then we're using this metabolic data, right? We're looking at what the carbohydrate data, right? What the substrate data tells us about energy utilization, right? Am I more energy efficient or am I more energy inefficient, right? Do I switch over to carbs pretty quickly and stay there? Or can I support fat metabolism across a wide range of heart rates? And so being able to look at that substrate gives us an idea of the change in intensity, right? When I have this big shift in fat versus carb utilization such that I drop down in the fat and I raise up in the carbs, that's a shift in intensity. And so what that allows us to do is program exercise that's going to target those adaptations. And what matters a lot in terms of targeting more of the zone 2 adaptations is volume. Can
Hmm.
I do this multiple days a week for a long period of time? If I shift up too much in the intensity, then that affects my ability to recover from that effort.
Yeah.
And so that means that I'm not going to be able to get as much volume over time, which means I'm not going to drive those adaptations as optimally. We've talked before about how we're always trying to balance that signal for adaptation with our ability to recover. And so while, like let's say you onboard carbs, right? Let's say that you onboard more carbs in the beginning, right? Such that the RER isn't exact. You're still going to be going at an intensity according to that heart rate zone. So our body doesn't really care where the energy comes from per se. Like we're just trading carbons around, whether that carbon backbone comes from the carbohydrate or whether it comes from fat. Both have a carbon backbone. We're using that for energy. And so I'm going to have to after my exercise effort, I'm going to have to replenish that, whether that's coming from carbohydrate or whether that's coming from fat stores, right?
Yeah.
And so what really matters here is, am I doing my exercise efforts at the intensity that's most likely to drive those benefits that we see with zone 2 training, right? Increased fat adaptation, increased efficiency with fat across a wide range of heart rates. And so even if the RER is a little bit off during part of the time, because we've standardized the testing and we've looked at how we use substrate and over a little bit longer of a test length, we can say, okay, at this range of heart rates, you're going to be efficient, and we haven't jumped up in intensity yet.
Yeah.
And so that allows us to manage intensity in such a way that we can get the volume of training in and recover from that volume of training and drive the adaptations that we're looking for.
Yeah.
And so having the CO2 data to look at those changes in efficiency, how we're utilizing fat versus carbohydrate, I think is essential for making sure that our exercise efforts are really optimized to select for the adaptations we want to see.
Yeah, absolutely. So Mark and I were just talking about this on a previous podcast that we filmed this morning that we talk about a triangle between frequency, intensity, and duration of exercise. And that triangle, we want the surface area of that triangle to essentially be about the same or only small amounts of growth in that. So if we're increasing the duration, then we probably need to bring down the intensity or frequency of how often we're doing that training. Or if we're increasing the frequency, probably need to bring down the intensity and duration and whatever, however you adjust that triangle. You want only small increases in surface area. If you increase both the duration and intensity, you're going to get injured. And so being able to balance all that out while using heart rate as a good metric for if you're doing that well or not, I think is very, very important. And so heart rate's correlation to fat burn and carbohydrate burn is a critical piece in measuring kind of relative intensity on a day-to-day basis. This is something Mark and I always say, lifting or performing cardiovascular exercise without knowing your heart rate zones and where your heart rate is somewhat akin to lifting weights without knowing how much weight is on the bar. It's not that you couldn't get a good workout in. You just have no idea if you did or not, and you don't really know the amount of load you put on the system to know how much recovery you need and, how hard did I really push today so that you can minimize injury risk and mitigate other problems. And so knowing your heart rate zones is so critical. And the reason why that's critical is because it correlates back to metabolic systems, what fuel sources we're burning, and what intensities we can sustain, which with fat burning, we can sustain those intensities for much longer. And then with carbohydrate burning, we tend not to be able to sustain that quite as much. It makes us hungry, it makes us more depleted. When we're depleted of those carbohydrate reserves, we're less likely to rebuild tendon, ligament, bone, muscle until those carbohydrate reserves have been built back up. And so our injury risk climbs. And so that's why paying attention to those heart rate zones is so critical, and why dialing that in, using that fat and carbohydrate burn information that we get from CO2 is so vital, because it lets us know where those zones really are at. And like Marc said, there is sometimes some minor fluctuations, but it's more about the intensity that we're training at that it is more important when we look at that in the long run.
Yeah, let's just dial that intensity in really well.
Yeah.
All right, next let's talk metabolic flexibility.
Metabolic flexibility.
And so I think this is another really important point. And metabolic flexibility, why can I not say that word today? Metabolic flexibility is really our ability to switch between fuels efficiently and quickly. And this is important because that is a normal part of a healthy metabolism. Our body, as we mentioned before, is always using a mix of fuels, pretty much always using a mix of fuels. And so depending on the intensity, depending on the activity, our body can say, oh, you know what, we need energy a little bit quicker. Let's break down carbohydrate a little bit quicker. Or, oh, we're going to be doing this for the long haul. Like, let's optimize for fat. And can I switch quickly between those two? So in the healthiest individuals, we see, and this really is this highlights the importance of not only cardiorespiratory fitness, but also muscular fitness.
Mm-hmm.
The healthiest individuals can switch really quickly between those two for a number of reasons. So one, their ability to get oxygen in, to transport it where it needs to go, and then to utilize it at the cell is really efficient, right? We've got good capillary networks. We've got a lot of mitochondria in the muscle cells that can process that oxygen and use it to turn it into energy. And so like our transportation, our utilization system is very efficient. But then also our muscles are storing the energy that we need, and they can move that around quickly. And so you see athletes have a high amount of glycogen. They max out the amount of glycogen that they can store in their muscles, right? So that's our body. Glycogen is our body's storage form of carbohydrate. And so have a lot of that in the muscle. And then they actually also have, it's an intramuscular lipid droplet,
Mm-hmm.
which is interesting because we talked before about when fat infiltrates the muscle, like that can be a sign of poor health.
Yeah.
So they call it the athlete's paradox. But the place of this lipid is different, and how often it's coming in and out of that cell is different, right? The flux, so how quickly it's coming in, how quickly it's leaving, is much higher in athletes. And so readily accessible carbohydrate, readily accessible fat right in the muscle cell. And so we can easily switch between fuels. And so when we have metabolic flexibility, we can see across a wider range of heart rates, people are typically going to be a lot more fat efficient, right? They can easily use that to fuel exercise for a longer period of time. People that have more metabolic inflexibility, we typically see very low fat burning across the range of the test, and that switch over is pretty quick, where I'm higher at burning fats, and then boom, now I'm all carbs, like that.
Yeah.
And we can see these kind of stark inflection points when we have that substrate data available.
Yeah, it really lets us know metabolically how healthy is somebody. And so when you're combining that with a fitness assessment, it's really important not just to quantify, like, are you fit or not? If not, why not?
Yeah.
And even if you are fit, are you really doing what you need to be doing to maximize your fitness and to get the most out of every workout and avoid injury? And those are those insights that it gives you. So being able to be metabolically flexible is really important for the athlete, as well as just the average weekend warrior. to avoid high A1C levels and high blood sugar and obesity and type 2 diabetes, all of those things that factor in with poor metabolic flexibility. If we're not able to use the muscles that we have as kind of this metabolic sink, as the ability to sink glucose and clear it from our system so that we don't have high blood sugar. Having big muscles can really help with that, or at least efficient muscles can really help with that, and can make it so that we can get rid of that high blood sugar, bring it back down, control that, maintain healthy A1C levels. And so making sure that our training supports that metabolic flexibility,
Yeah.
very, very important.
Well, so one of the things that you mentioned before is like, people can still be very kind of fit, but then how efficient are they? So
Right.
so our VO2 max gives us a good idea of the capacity of the engine, right? It gives us that snapshot of where we're at, but then that substrate data gives us insight into the efficiency of that system.
Right.
And so in a hypothetical example, you could take two people with the same VO2 max, right? A VO2 max that's high that shows that they're fit. And so in terms of mortality risk, like similar benefits in terms of risk reduction for mortality in that high fitness. But then we look at their effective fat burn graphs, right? How are they utilizing substrate? And that can reveal some fascinating insights, such that even though they're the same VO2 max, one person may be very efficient at utilizing fat across a range of heart rates. One person may be very inefficient. And so that high top end of fitness is great, but then there's some inefficiencies that, in their younger years might not be as much of an issue, but can be more of an issue as they age, right? If there's less metabolic flexibility, then when things change with age, when we put on a little bit more weight, things like that, then those inefficiencies kind of become more glaringly obvious.
Honestly, a lot of the time I could tell you who would win a race even based on that. I one time tested two athletes that had a fairly similar. One was like a 72 and one was a 74 VO2 max. But I could tell you right away that the one was going to smoke the other in a race, and he did. He beat him by like 5 or 6 minutes. And it was because his fat burn went so much higher up into his heart rate zone. He was at 175 beats per minute and still burning 50-50 fat and carbohydrate. And where that leads to performance is he can go so much harder and still be burning a much higher percentage of fat. So he's getting a lot less metabolic byproduct. He's getting a lot less fatigue. He's not going to bonk as soon into the race. All of those types of factors. And the one had a fairly sensible fueling strategy, and the way he trained optimized for improved fat burning and things like that. And the other started a lot of his races mixing his favorite kind of pre-race glucose powder in with a Red Bull. And so like it worked, and he was an excellent runner, by the way. But the other guy tended to, be setting course records and PRs and things with every race, while as the other tended to do well, but just not quite as effective. And so, he did a lot more training his body to use carbohydrate really, really well. And so he was very effective at that. But because he always was dependent on this very quick acting fuel source, he always needed more of it to sustain those levels of intensity and energy. Whereas the other person was more fat adapted and could go longer with needing less fuel, and so had fewer stomach issues and other things that could frustrate the race.
Yeah.
And because he wasn't pushing as relatively hard, psychologically, that was less draining on him as well. And so, lots of factors there where that really can lead to improved performance when we can improve our fat burning.
Absolutely. All right, let's talk about threshold detection and why the CO2 values are important in there. And I think this is an important point, because when we're really looking to how can I, really help this athlete, this individual be more efficient and make sure that their efforts are matching their goals.
Yeah.
Again, for like mentioned before, we have versions that just use the O2 that use a certain method for detecting threshold. And again, that can be great for so many things, and it gives people an idea of a starting point. But the way that thresholds are measured with O2 alone leaves some data on the table, and it can make that detection a little bit less accurate.
Hmm.
So uh, systems that use O2 alone, one of the typical methods that they use is your ventilatory equivalence graph. And so
Hmm.
that's taking your ventilation divided by your volume of O2. And it's looking for a couple of inflection points. So for the aerobic threshold, it's looking for that lowest point in that graph just as it starts to rise. And then for your anaerobic threshold, it's looking for a sustained rise
Hmm.
in
Right.
in that line.
Kind of the most dramatic increase in slope that's a sustained rise in that slope. Yeah.
Absolutely. The difficulty is that it can be pretty affected by artifacts, by breathing artifacts,
Hmm.
especially if we're already using breath by breath versus mixing chamber. There's just more noise in that data. And so then trying to pick out the aerobic threshold and anaerobic threshold out of that cannot be as accurate. That improves with the mixing chamber where there's less noise. But when we add the CO2 data, it allows us to look at that in a couple of different ways. Even if we're still just using the ventilatory equivalence graph, we can look at what's happening with CO2. So that aerobic threshold, the VE over VCO2 line won't rise that much versus the anaerobic threshold, both are rising together. And so it's another way to use that carbon dioxide data to see like, okay, is this really accurate? And then there's also other methods of looking at the anaerobic threshold, right? We can look at what's happening with RER,
Hmm.
right? When is there that crossover? And then we can also look at the VCO2 versus VO2 graph, and where there's that break point in CO2 rising faster. So you can use regression analysis software to look at that and identify that more precisely. And so it just opens up a world of additional methods that can improve the accuracy of those thresholds. And
Yeah.
so that's one of the benefits. I think we don't probably look at as much, but can still be nice for really dialing in and saying, okay, where is your anaerobic threshold? And then what do we need to do to train that?
Right. And well, that's something because I've always used a system that had CO2. I didn't appreciate how much of a fluctuation you can get by looking at just O2 only. And so as I've worked with some people who have systems that are O2 only, I see the difficulty in interpreting those things, especially like you said with a breath by breath system, especially a wearable breath by breath system. The data is so noisy. You're getting artifact data from their footfalls. So even, if you were just to take a wearable system off and shake it, you'd get data. And so the the artifact data from that and trying to smooth that into usable trend lines, it becomes there's a lot more error there in detecting AT or other inflection points. And so we'll find that there's often a 10 or 15 beats per minute difference in those, threshold points. And where that's significant is 10 or 15 beats per minute. You can be using completely different fuel sources. You can be, very different in terms of your effort level, even perceived exertion within 10 or 15 beats per minute. I've seen people go from a zone 2 to a zone 4 in 15 beats per minute. And so you really have to be careful um, with those systems that there is some inherent inaccuracy. And so the more variables you put into the system, like being outdoors with crosswind and all of those things, the artifact that you get can throw some of that off. And so to me, that's why it's so important to eliminate as many variables as possible so that we can get accurate data.
Absolutely. Well, and then to your point, I want to mention what you said about we're looking at RPE, right? Again, this substrate data is really useful, but then we're tying that to other things, right? How is your heart rate responding during
Yeah.
exercise? What's your rating of perceived exertion, right? On a given day, I'm supposed to be, my usual pace. I go out, and all of a sudden, my heart rate is much higher at that same pace. My effort level is much higher at that same pace. Well,
Yeah.
that's a good signal that, like, hey, maybe I'm not well recovered enough. Maybe I'm
Right.
getting sick. Maybe there's a stressor that's weighing on me. And so, like, let's drop down the pace to get back to that heart rate range.
Exactly. So I love using heart rate as kind of that anchor. And the more physiological points that we have, like heart rate, rating of perceived exertion, RPE, power output, things like that can really help us dial in. If my heart rate is high on any given day, why is that? Was it poor sleep? Was it poor nutrition? Was it my kid failed his math test and I'm stressing about it? Whatever that is, that could be adding increased load onto the system by training according to our heart rate. We can more accurately protect ourselves, and so having those data points of really quality heart rate zones so that we know where we're at and why different days may be, because I've had many days where I've been out training when my RPE was totally fine. I was, a 4 or 5, felt really good. My legs and lungs felt fine, but then I noticed that my heart rate was really high and going, what's the deal today?
Yeah.
It's not that hot. I don't think I'm dehydrated. Like, why is it so high? And the next day, my whole family gets sick and I don't. And had I pushed it because I was like, oh, my legs and lungs feel fine. My RPE is low. Like, I don't know why my heart rate's so high today, but I'm just going to go for it.
Yeah.
Had I not, I probably would have gotten sick too because it would have decreased my immune response and things like that because I would have overtrained for the stresses that were being put on my body where I had to, um, fight off this illness. And so my body felt that even if I didn't.
Yeah. Well, I think this goes back to that idea of like using the data not to just get a picture of where I'm at, but where I've been and where I need to go next.
Mhm.
And when I see the data that I'm getting, what questions does that cause me to ask, right? Where do I want to dive deeper, right? What's my stress level? What else is going on?
Yeah.
And this actually leads us to the next point of how that CO2 data can give us insights into efficiency, right?
Yeah.
And can point us in the direction of asking deeper questions, right? What's going on with the cardiorespiratory system? What's going on with metabolics? What
Yeah.
questions do I want to ask? And maybe what follow-up test do I want to perform to get some more insight into what's happening?
Right. So at the beginning, I kind of alluded to that CO2 is critical for really weeding out where our inefficiencies or problems are coming from. If we have cardiovascular disease, if we have metabolic issues and metabolic syndrome, if we have problems, cardiovascular system, respiratory system, metabolic system, those are the three key systems, as well as then exercise efficiencies and inefficiencies. Being able to look at our tolerance for exercise and how um, efficient we can stay over a longer period of time, things like that. We can dial all of that in looking at carbon dioxide. And so being able to dive deeper into, is this a perfusion problem? Is this a stroke volume problem where the heart's just not beating hard enough? Or is this we're over ventilating, but actually poor perfusion so that we're not exchanging oxygen and carbon dioxide well enough? We have insights into all of that information when we measure CO2.
Yeah. And so again, what line of questioning do I want to go down? Where do I want to zoom in on? And the reason that it can tell us that is so let's go back to something you said,
Yeah.
cardiac output. So cardiac output is stroke volume, how the volume of blood that the heart's pumping per beat, and then heart rate, right? How fast is my heart pumping? If I'm really efficient, right? If I have a strong heart and I have a well-developed capillary system, blood vessel system, then I can get a large volume in and I can pump that out efficiently. And so I don't need to increase heart rate as much to get the same volume of blood around.
Yeah.
But if I have a weak heart, or if my capillaries just aren't great, or there's a lot of resistance to that pump,
Mhm.
then I'm going to have to increase my heart rate. I'm going to have to pump more blood so that I can get that same volume out. And so what's going to happen with that is that my breathing rate's also going to increase. Um, because with each pump of the heart, right, we're getting oxygen into the blood, we're getting carbon dioxide out of the blood. And so if that blood just isn't crossing that capillary bed as fast, we're going to exchange less oxygen, we're going to exchange less carbon dioxide. And so if we really need to get carbon dioxide out, I'm going to have to increase my heart rate, I'm going to have to increase my breathing rate to get that carbon dioxide out faster.
Yeah.
And so that can give us an idea if that, so we talked about the ventilatory equivalence graph, right? How much do I have to ventilate to get out a certain volume of CO2?
Yeah.
We're going to see that pretty sharply increase if that system is inefficient.
Yeah.
We're also going to see that in terms of like if we see obstructive or restrictive lung diseases where we're just not able to get as much gas exchange across the alveoli. Right? If we have a lot of dead space, only a certain proportion of our ventilation is going towards that gas exchange. And so again, we're going to have to ventilate more to get CO2 out. But with those lung diseases, our ventilation's going to kind of max out at a certain point. We can only ventilate so much before we max out, and so we're going to see those reflected in the breathing data as well.
Right, that's where we can detect that inefficiency, and it's not that the volumes always change a ton. It's just the relative volume of carbon dioxide that we're getting rid of doesn't keep pace, and so we see this steep slope in your VEV CO2 graph, and that lets us know, okay, we've got an inefficiency there. And so that allows us to dive deeper. Whenever we see that steeper VEV CO2 graph, we know, okay, we've either got a pulmonary or a cardiovascular problem.
Yeah.
And so that allows us to really dive deeper into, okay, where's this coming from? What's going on? How do we differentiate between the two? And there are some ways that you can tell whether it's more of a pulmonary versus cardiovascular problem. And so you can really do a lot more to dive into what is this person's specific problem. And I think we're going to talk with Daniel Crumbach about this actually coming up in a couple of episodes. So really excited to dive deeper into really how this data helps us analyze, is this a cardiovascular problem? Is this a respiratory problem? Where are these things coming from? And so the insights you can gain by just getting one more data point in that CO2 is massive.
Yeah. Well, another one is, again, now we're looking at that metabolic system. There are certain diseases that disrupt the acid-base balance in the body.
Yeah.
So CO2 so it comes from cellular metabolism, but it also comes from buffering acids in the blood. And so if there is a metabolic disease such that we're having a higher acid load in the blood, then our body's going to be naturally producing more carbon dioxide to offload that from our body. And so that will show up in the breath data as well. And so we're going to see that earlier shift and that earlier rise in carbon dioxide as well, because the body is already having a struggle getting offloading that enough. And then we start exercise, that's going to increase even more because now we're adding more of that acid load due to the intensity of the exercise.
Yeah, if somebody's in a state of chronic inflammation, you'll often see that their fat calories, if you're talking, it takes 35 to 4,200 calories to burn 1 pound of fat in terms of fat metabolism. If you're only burning 60, 80 fat calories an hour at a given rate, that's a lot of hours that you have to spend burning calories to lose that weight. And not that you only have to burn fat calories to lose fat weight, but that idea of the more efficient we can be at fat burning, the more likely we are to burn stored fat.
Yeah. Well, and I think one of the difficulties is when we're doing exercise that's burning a lot of carbohydrate, like you mentioned before, typically our drive for eating that back is going to be stronger.
Right.
And and then like I'm not going to be able to do as long of efforts and recover from that. And while exercise doesn't necessarily have a huge effect in weight loss, it does have a really big effect in terms of weight maintenance. And in weight loss, there's still a dose response effect. And so if I'm limited in the amount of cardio exercise that I can get, because it's always so intense for me, then I'm just not going to be able to burn as many calories overall. And so, optimizing for that fat burn is going to help me to be at an intensity that I can sustain over the long term. And it's also going to drive those adaptations that are going to help me to be more metabolically flexible,
Yeah.
which is huge in terms of metabolic diseases. Um, one of the great things about exercise, and this happens with both aerobic exercise and resistance exercise, is that we have this insulin independent pathway of getting glucose into the cell. And so when we exercise,
Yeah.
we get basically little chaperones come to the cell surface that say, hey, sugar, come on in. And we don't have to have insulin release for that. And so this is actually a really effective way, especially for people that are diabetic, that have insulin resistance, things like that, to help begin to turn the dial on their health, turn the dial on that insulin resistance, and help them get back to a healthier metabolic state.
Which, I mean, we have so many people living in, pre-diabetes right now in our country. And so reversing that, kind of being able to take over from that and train your body to become more fat adapted. So it's not always running on carbs, but also not always craving carbs and things. So even the way we train can switch that up, and we get those insights by getting this data, so that we can train in a way that supports healthy metabolism and supports avoiding as many simple carbohydrates and things like that. So, like you mentioned, the reserve that we have even of carbohydrates on our body is much smaller than the reserve of fat, and so we can sustain lower intensities for so much longer. The average healthy person, at the kind of lowest low end of healthy, you're talking about what, 50, 60,000 calories of fat stored on their body. Up to about 125,000 calories stored on their body is actually a fairly healthy range.
Yeah.
Which you think 125,000 calories is, or 105,000 calories is a 150-pound person with 20% body fat has 105,000 calories of fat stored on their body.
Yeah, that's significant.
That's days and days and days worth of energy. Whereas that same person probably has between 1,400 and 1,800 calories worth of carbohydrates. And so if you're exercising at a rate of 500 or 600 carbohydrate calories per hour, and then some mix of fat as well. But if you're at that rate of, like, let's say 500 fat calorie or carbohydrate calories an hour, within a fairly short amount of time, you've depleted those carbohydrate reserves stored in your muscles. So we've got 600 to 800 calories worth stored in our liver for maintaining our blood sugar. You've got the rest kind of distributed throughout your skeletal muscles, plus some in your bloodstream. So in your running muscles at any given time, if you've got 1,600 calories worth of carbs stored on your body, you probably in your running muscles only have 500 or 600 calories worth of carbohydrate. So if you go on an hour-long run, you've depleted those carbohydrate reserves, and you're going to have to eat that back, because that's that baseline system of fight or flight, of having some glycogen on board to be able to do that quick activity, and your body will preferentially replenish that before it does a lot of other things like we talked about before, like tendon repair, ligament repair, bone density, maintenance and repair, muscle repair. And so if we're always in this depleted state where we're craving carbs from our workouts, and it just makes it harder to maintain a healthy lifestyle, because we're always in this recovery state where we feel kind of beat up and burnt out and broken down. Whereas when we work out in a zone where we're training those fat systems more and we're depleting those glycogen stores less, we burn more of what we intend to burn, which is always a plus. We are more likely to have that be sustainable, where it's at a workload for our body that's much more sustainable. So we're not always depleted, always fatigued, and we can continue to participate, which it's stringing together a bunch of days of exercise, which actually helps us make the most improvement.
Yeah, I mean, if we're talking about health span, right?
Yeah.
How do I stay healthiest for the longest period of time? Then being able to understand and manage, recovery, stay consistent in our workouts is really going to lead to that large health span over the long time.
Yeah.
And also in terms of performance, right? Like, it can help us get insight into when and why we're bonking, right? When we hit that wall.
Big
and
time.
so knowing how we're using substrate and knowing when that anaerobic threshold is we can start to change how we're eating, how we're training, such that we increase that anaerobic threshold, and that we don't have to onboard nutrition as quickly,
Yeah, or
because, like you said, we're more fat efficient.
yeah, that way we can optimize our, training fueling better so that we can make sure that we're fueling our body the way that it's most adapted to and the way that's going to fuel us best for the activity that we're doing. By getting some of those insights into our fat and carbohydrate burn ratios, the amount of fats and carbs we're burning at any given heart rate, things like that, really does help us dial in for athletes and non-athletes. Helps us dial in how many calories should I be eating during an event. How should I plan those nutrition strategies so that I'm fueling my body appropriately, not overfueling and causing gut issues while still giving myself enough carbohydrate during a longer or more intense activity that I can maintain those energy levels. Yeah, it's so helpful in dialing a lot of those things in. Well, again, alluding to another future episode, we've got a runner that's going to come on that I'm pretty near and dear to. Um,
Good tease.
yeah, my wife, who is just interesting because of the way she grew up in sport and everything, and then this transition to training with me and having to kind of lose some of the beliefs that she'd had her whole life about how to train and the improvements that made. But being able to go and run, 18 miles without needing to take on a lot of glycogen and stuff like that, or I guess glucose at that point. Yeah, super helpful in being able to build those endurance systems and things like that. So we'll talk with her about that in a future episode.
No, that'll be fun. But just lots of great data that we can glean. And I think going back to what you said earlier of that snapshot in time versus, what do I want to be doing, right?
Right.
What have I done? What am I doing? And is that going to be effective for the goal that I want to reach? And so it really allows us to personalize the data a lot more.
Oh,
Like you
so
mentioned
much more.
earlier, we're seeing these metabolic insights, we're seeing these kind of metabolic shift points, these inflection points, and that allows us to really dial in on the heart rate zones. And we've talked about before about the kind of population data that research gives us that is incredibly helpful, but then that kind of N of one of, okay, taking this population data, how does this apply to the person?
Right.
And so population data is really great for looking at trends in population.
Yeah.
What's the change in my mortality risk? What's the change in injury risk, et cetera, things like this. But it doesn't always give us as good of dialed in data for the individual. And so sometimes it's like, oh, I'm going to take the population data and that kind of puts people into cookie cutter programs,
Yeah.
which I'll be honest, like that is great to like, anything that's going to get people to exercise. I'm so for.
Well, and if we applied that cookie cutter program to the entire population, it's going to benefit enough people that the net positive would be great. But you'll find that individuals throughout that struggle.
Yeah.
Right?
For some, it may be too much. For some, it may be too little to get the adaptations that we're looking for.
Right.
And so being able to zoom in on these metabolic insights that we're getting through the substrate level data allows us to set zones in such a way that we're driving the adaptations that we're looking for, and we're also managing intensity so that we can balance stimulus for adaptation with, again, recovery and making sure that stays on track so that they can grow their capacity over time.
Right. And so it really is CO2 data along with the O2 data that we've, always collected.
Yeah.
Really does offer such a great bridge between the health community and the fitness community, which really should be one and the same, in my opinion. But it creates such this great bridge of taking real science and real data about your body and the way it's functioning and your health and how your body can process calories and how it can sustain workloads over time, and apply that then to our fitness and what we're doing for our training, so that what we're doing for our training really is what's best for our health and what's going to help us move the needle the most. Such great insight that we get from testing somebody with a device like the Cardio Coach.
Yeah. Well, and again, I just want to go back to some of the things that we said earlier and highlight this bridge between fitness and kind of the medical world.
Yeah.
And we talked about how on the medical side of thing, it gives us insight into, okay, do we want to take a deeper look at the cardiovascular system? Do we want to take a deeper look at the respiratory system? Do we want to take a deeper look at what's going on, metabolically? And then and so like that test can tell us this, but then also, hey, how do I improve performance? How do I make exercise more enjoyable and more sustainable? And so being able to see both sides of these can take someone anywhere on the spectrum, right? Like I'm doing all right, but I want to get a little healthier, or hey, I really want to get into the performance side of things, or hey, you know what? I'm not doing great health wise. What are some things that I need to do to what are some things I need to implement to get to a healthier level? Like we can capture all of this data and help people to make the decision about what's my next best step, what's the next right step to take to
Yeah.
move me in the direction of my long-term goals.
Yeah, and that really is the key, is that we can do those things that help us make stepwise linear progress instead of this like roller coaster that we tend to be on in the fitness world, where we just keep following the next trend that passes through. Instead, we can go back to, what does my body need? Where am I at, and what do I need to do to move forward? And so I love that about the cardio coach, that it gives me such great, concise data, that it's so easy to use, the self-calibration, the ability to quickly and accurately analyze the results without having to run all these regressions. Even though you
Yeah,
can export that data and run all kinds of different regressions and things like that. But it also allows you, just with the native software, to dive so deep into somebody's efforts and intensities, their heart rate zones, their thresholds. It allows us to take a closer look into how they're burning fats and carbohydrates. It just gives us so much information that we can build a more accurate exercise prescription for an individual, so that they really can finally start to see progress. I can't tell you how many people I've worked with that came in saying, I've tried everything, just devastated, in tears. And I like to kind of take the blame off of them and tell them, it's not your fault. You just haven't had the right data for your body yet in your life. And now with a cardio coach, we're going to get that data for you, and you're going to be able to move forward with your fitness and feel better and have more success than you've had in the past. And so with the cardio coach, there's a couple of different models, right?
hmm
The Max and the Pro are the ones that have CO2 data. And so they're going to give us the deepest insights. So if you're training clients, if you're a medical facility, you definitely want those higher end insights that the Max and the Pro models would get you.
definitely.
And so if you're really working on changing somebody's fitness, those are the models that you want, is the Max or the Pro. If you're looking at just measuring RMR and VO2 max, and those are the main values that you want to get. If you're just measuring those things, which is great, there's some applications for that where, like, I just need those two numbers for, I alluded to firefighters and police officers and stuff like that, that they need those values to be able to certify every year for their fitness tests. Great, those devices do that. But if you want to get any additional insights into how they're training, how they're performing, and what they can do to improve, um, that's where the Max and the Pro come in. And I particularly love the Pro because of the additional data analysis tools that it has, the additional depth of analysis through having more data points to analyze and things like that, make it just so valuable in the clinic to be able to really dive deep into that person that's standing in front of you, and giving them hope through the additional insights that we can give.
Yeah.
It's so powerful.
Well, I think that really is the power of good data, that it
Mm-hmm.
just helps us to make better decisions. And we don't have to rely on fads. We don't have to rely on I hope this will work.
Yeah,
We
the
can
guessing
see the
game.
guessing game, right? We can see, is this
Yeah,
actually working? Is this trending towards the right direction?
yeah,
And really, like these different models, it's what you mentioned earlier. It's, do I just want a snapshot? It's descriptive, and so that's what the basic and the plus are gonna give us, is that snapshot of the data. I can tell, like, where do I pass the line for fitness qualification for
right.
this thing, or what's my absolute mortality risk. And so that can be really nice for that. But then if we want that prescriptive data, having those higher models that are going to allow us to really help people to make big long-term changes in their fitness is crucial. And so yeah, just having all that data available and having it in such an easy way to interpret and to give to clients has just been so helpful. And I love that point of like helping people understand that it's not their fault, that they're not broken, and that there are tools available to help them to get to a healthier place. We were talking the other day, and you said one of the things that people will even say to you are like, "Oh, I've done VO2 tests before."
Yeah,
And
oh,
you're
that
like,
kills me.
yeah,
Because it usually means, well, you didn't have a very good quality test done before.
yeah.
Yeah.
And so that's the nice thing is with this data, it's like, okay, we can really dive in, we can really get specific, we can really just get this robust set of data, robust set of indicators of where am I at, where do I want to go, how do I get there?
Right. Well, and if people don't understand that they need to retest,
Yeah.
then that also is like, oh, then it wasn't explained to you very well what this is and what it can do. Having it done once doesn't cut it. You need to be retested every so often with each phase of your exercise and training, whenever there's been a shift in your lifestyle, things like that. Let's dial in those numbers again so that we can get back on track with what does my body need right now so I can maximize my fitness efforts.
Absolutely. Okay.
Awesome.
I think that's a wrap. But it's just fun to talk about this. And I think just again, going back to like, this is just basic physiology. This is how our body works.
Yeah.
And we're just, kind of zooming in and seeing, oh, what's actually happening in my body at a cellular level, at a respiratory level, at a cardiac level. Like, it's just some really amazing insights that we can see. And it's not, it's not made up numbers, right? We see a lot of trends and modalities and stuff come in and, oh, you need to focus on this and it's this one thing and whatever.
Right.
And it isn't even tied to how our bodies work. Like, you're missing out on basic science, you're missing out on basic physiology. Like, cardiopulmonary testing is well established research, right? Like, we started.
We're talking 100 years now that they've been measuring O2 and CO2 values.
Yeah. And this is fundamentally, how does my body work? How does my body process energy? And we're just using the cardio coach as a tool to see what's happening real time with your physiology so that we don't have to make guesses, so that we're not relying on prediction equations. We're seeing how is your body working, and based on that data, what do we need to do?
Yep.
So anyway, thanks so much for joining us. As always, remember to like, follow, and subscribe for more content like this, and we'll catch you next time. This podcast is a production of KORR Medical Technologies. Ready to take your metabolic testing to the next level? Visit KORR.com to learn more about purchasing our metabolic test equipment.